The following is a summary of the article titled Association of the FGF4L2 retrogene with fibrocartilaginous embolic myelopathy in dogs. This summary does not do this article justice given all the figures and tables. Please download and review the article if you are able to. To start with the introduction, fibrocartilaginous embolic myelopathy, FCE, is a disease commonly found in dogs. Its pathogenesis has remained elusive since the 60s when it was first discovered in humans, and in 1973 when Ian Griffiths first reported it in dogs. FCE is most commonly reported in giant and large breed dogs, but small and medium breed dogs represent about 30% of the population. There is a higher frequency of FCE in specific breeds, however, few findings have been reported relative to general hospital population data. It is noteworthy that FCE cases have rarely been reported in presumed chondrodystrophic dog breeds. Recent definition of the fibroblast growth factor 4 retrogene 2, FGF4L2, has provided a more objective means of assessment of chondrodystrophy-associated disease through genotyping of affected animals. The low frequency of FCE in chondrodystrophic breeds might be related to characteristics of the embolized material or the vascular system in which embolization occurs. Several disease conditions resulting in intrinsic myelopathy can mimic FCE. Even in the era of MRI, diagnostic criteria for FCE have not been validated, and coexistence or connectivity of embolic disease and acute non-compressive disc extrusion has not been defined. We hypothesize that presence of the FGF4L2 retrogene would be negatively associated with FCE cases. The study's primary objective was to define the association between the FGF4L2 chondrodystrophy retrogene and FCE in histopathologically defined cases. The secondary objectives were to define the association between the fibroblast growth factor 4 retrogene 1, FGF4L1, chondrodysplasia, and FCE in histopathologically confirmed cases, and to compare breed data from the study to historical published data, including both histopathologically confirmed cases and suspected cases. For the methods, in this study, cases of FCE were diagnosed by veterinary anatomical pathologists from 8 veterinary institutions: Auburn University, University of California Davis, Cornell University, University of Georgia, North Carolina State University, University of Pennsylvania, Texas A&M University, and Virginia, Maryland, using paraffin-embedded formalin fixed tissue for DNA extraction and genotyping. Historical data on FCE breed frequency were obtained from case series and single case reports that included owner-defined breed data. To perform genotyping of the FGF4L1 and FGF4L2 retrocopies, DNA was extracted from formalin-fixed paraffin-embedded tissue samples using a quick DNA FFPE mini-prep kit. Genotyping PCR products were visualized through agar gel electrophoresis. Breed allele frequencies for FGF4L2 and FGF4L1 were determined based on the combined data from Batcher et al. And the Veterinary Genetics Laboratory at UC Davis. The independence of FCE and FGF4L2 and FGF4L1 genotype status was determined by comparing the FCE retrogene allele frequency to the predicted frequency of the FGF4L1 and FGF4L2 alleles in the general canine population from the UC Davis Veterinary Hospital. The breed predisposition for FCE was identified in breeds with more than 2 cases in the study population based on the total hospital reference population at UC Davis during the study period, April 1987, June 2020. Statistical analysis was done using GraphPad Prism 950. Breeds predisposition and independence of FGF4L2 allele frequency in FCE cases versus the total population were analyzed using a two-sided Fisher's exact test. Odds ratios were reported with 95% confidence intervals using the Wolf-Logit interval. The significance was defined as p.05. For the results, the study included 98 cases of fibrocartilaginous embolism, FCE, causing embolic myelopathy, diagnosed through histopathological examination. The cases were collected from 8 institutions over a time period of 33 years, from April 1987 to June 2020. The study included the breeds Labrador Retriever, 14 cases, Boxer and Great Dane, 8 cases each, Rottweiler and Yorkshire Terrier, 6 cases each, and a mixture of other breeds. The median age of the affected dogs was 6 years, with 46% females, 36 neutered, 9 intact, and 54% males, 34 neutered, 19 intact. Genotyping was successfully performed on 91% and 81% dogs for FGF4L2 and FGF4L1 respectively. 2 dogs were found to have the FGF4L2 allele. One was homozygous and the other was heterozygous, both being Labrador Retrievers. The study found that the frequency of FGF4L2 allele in FCE cases was 1.7% and the frequency of FGF4L1 allele was 15.2%. The FGF4L2 allele was rare in all breeds represented, with the exception of Basset Hounds, which carried wild-type alleles. Breed predisposition was analyzed for 9 breeds with 3 or more cases in the UC Davis Hospital population over the study period. The analysis showed that 7 breeds were overrepresented: Boxer, Great Dane, Yorkshire Terrier, Bernese Mountain Dog, Miniature Schnauzer, Rottweiler, and Shetland Sheepdog. Labrador Retrievers were the most frequently represented breed in the study and also represented over 14% of the total hospital population, although their representation was approaching significance. The breed frequency in the published FCE case series and reports were compared to the study population. Among the study predisposed breeds, all were represented in the presumed FCE dataset, while except Rottweiler and Yorkshire Terrier, all were represented in the histopathologically confirmed dataset. St. Bernard and Miniature Poodle were present in the published confirmed group, but not in the study or published presumed FCE groups. Staffordshire Bull Terrier and Border Collie were present in the published presumed group, but not in the study or published confirmed groups. Going through the discussion, this study, which utilized histopathologically confirmed cases in FGF4L2 genotyping, confirmed the low incidence of fibrocartilaginous embolism, FCE, in presumed chondrodystrophic dogs. The dogs in our study were similar in age and breed to previously published data, with a median age of approximately 6 years and predominantly larger breeds affected. FGF4 retrocopies, specifically FGF4L2, have been associated with chondrodystrophy and moderate limb shortening, but no additional genetic loci have been identified to be associated with premature intravertebral disc degeneration. Breeds that were previously believed to have chondrodystrophic features have been found in recent studies to not carry the FGF4L2 retrogene, while some larger breeds and breeds without typical chondrodystrophic features can carry the FGF4L2 retrogene at low frequencies. Published reports of FCE in small, presumed chondrodystrophic breeds were retrospectively associated with breeds that had low FGF4L2 general population allele frequencies or segregate the allele at lower frequencies. The pathogenesis of FCE remains unclear, and proposed mechanisms include arterial or venous embolization through various means. It is notable that pressure within the intervertebral disc and vascular system could provide sufficient force to facilitate nuclear material penetration. FGF4 overexpression via the FGF4L2 retrogene is implicated in premature intervertebral disc degeneration in chondrodystrophic dogs, but the exact mechanism relating FGF4 overexpression to premature IVDD is not defined. The formation of the vascular system involves de novo formation of blood vessels followed by angiogenic remodeling. FGF4 overexpression via an active retrogene might have implications for the development of a vascular system that could affect predisposition to embolization in chondrodystrophic dogs. Study limitations include sample size and the use of surrogate population data for assessment of breed predisposition. The findings support historical observations that FCE occurs at a low frequency in chondrodystrophic breeds, and further comparative vascular studies of the IVD and spinal cord in this defined genetic group are warranted to clarify vascular anatomy that might be relevant to the pathogenesis of FCE.